DutyRon family, thank you so much for joining. April 18th, Saturday evening. If you're not new to my channel, if you are new, if you're not new, please hit the subscribe button, hit the notification bell, so this way you can get all things DutyRon. And if you want, follow me on all social media, all one word right here, DutyRon, across all social media platforms. That's Instagram, Facebook, and Twitter. I am a retired New York City police detective with 20 plus years in law enforcement, and I go live all the time here on YouTube talking about local crime, nationwide crime, worldwide crime, and all different breaking news events. Thank you to all my channel members, all of my great followers, subscribers, people from all my different platforms, the people from Periscope, Facebook. I greatly appreciate you guys coming on in and interacting. Hello to my good friend Katrina Catress, Daphne up in Canada. Hello, Heidi Leahy. Good to see you. Thank you for joining. Diane Dookie 4000. Thank you so much for being in here. Soul for Music 79. Great to see you, Sleeping Beauty. There's all the channel members coming on in, and happy, one of my new friends from Katrina's. Thank you for coming. Froggy, great to see you. I hope your treatment went well before. I was live on another platform earlier today, and Froggy came in, and I was also on another person's channel on YouTube, Premier Hell, good friend of mine, and Froggy wasn't feeling too well. So I hope you're feeling better. I hope everyone is enjoying this weekend, and I hope you are staying safe. Staying safe is most important, following the rules during this COVID-19 pandemic that we're all dealing with worldwide. There's not many people throughout the world that aren't dealing with this. So thank you to everyone for coming on in, relaxing, positively interacting with each other in the chat. That means a lot to me. Hello, Gail B. from all the way in Australia. Put another prawn on the Barbie, please, Gail. My birthday is in about an hour or less. Wow. It's about a half hour from now. I'll be celebrating my birthday tomorrow, but we're close to it. Thank you so much, One Bad Dab 6767. Thank you so much for the thumbs up. I appreciate it. Premier Hell coming on in, another channel member. So, guys, I am going to cover the news conference from Governor Cuomo from today. He went live with his daily conference. I'm going to cut out the parts where he argues back and forth with the president. I'm going to lock that out. Hello, Anna Morris. Great to see you. Angela ATF. I think I covered everybody. Paws and Boots is in the building. Pat and Jackie. Patty and Jack, thank you so much. Deborah, peace. Stay safe, everyone. Sophia Howard is in the building. Sophia, my good friend, and what a great woman Sophia Howard is, and her daughter, Amy. I greatly appreciate you guys. Thank you so much for coming on in. And it looks like Catwoman is here. Meow. Catwoman is here. Good to see you. That's the first time I have ever done that. That's a first and probably a last. You won't hear DutyRon do that often. There's a kind of just slipped out. Thank you, Patty and Jack, for the early birthday wishes. I greatly appreciate that. Thank you. All right, guys, so we're going to get right into it. I'm not going to talk for a good 10 or 15 minutes. You guys can talk amongst yourselves. Hi, Jonna. Thank you. Almost birthday. Ricard, thank you so much for coming. Appreciate you being in here. Mad Skills, that's Myrna, my good friend from Texas. Thank you for being a channel member and always supporting me on all platforms. Thank you so much for each and every one of you. I really greatly appreciate you guys coming on in. You know, and without the positive interaction with you guys, with leaving me messages down below in the comments section, interacting with me is paramount and is very important to me, because without the interaction, then it's really not worth it for me and for you. So for those of you who leave me all of the messages down in the comments section, I thank you for that. Thank you so much for that. Futures Past, thank you so much for being here. I appreciate each and every one of you. Thank you so much for the birthday wishes. All right, so we're going to listen to Governor Andrew Cuomo's daily press briefing. He's going to go over, we have some good news coming out of New York. Our death rate has dropped for the second day in a row, and I thank God. I thank God for that. We have been seeing for the last 10 days here in New York 700 plus deaths a week. And as Diane and I know, Dookie 4000, my good friend here in the chat, We lost our neighbor, Kathy, our friend, 2 doors down. She lives directly across the street from Diane. She lost both of her brothers, Michael and Johnny. I mean, what a horrific thing to happen. Her only 2 brothers, she lost them to COVID-19, all in a matter of 2-3 weeks. And it's just a crying shame that we have to see these type of deaths here in the Northeast and throughout the world, for that matter. There's so many stories out there. The stories are heartbreaking. The stories are heartbreaking. And as a seasoned law enforcement professional as myself, when I see these stories, it breaks my heart. When I hear about families losing both their parents, when I hear of brothers and sisters losing siblings, it's just a horrific thing to have to deal with. And Kathy, my neighbor for 20 plus years, 1 week to the day. Thank you, Diane. So for Kathy, a 20-year plus resident here on my block in my neighborhood, I've spent so many great times and great moments with her and her family, with parties, and Diane is much closer with them than I am. But just to have that happen so close to home, it really hurts. It really hurts, guys. And I have over 30 of my NYPD colleagues who have passed away from COVID-19, from being out there on the front lines. Our great men and women of law enforcement, our first responders, the police, the fire, the paramedics, the ambulance workers who are picking up all of the sick patients and bringing them to the hospitals, the hospital workers in the emergency rooms and different clinics throughout the world, throughout the United States. I tip my cap to them. Faithful One, thank you for being in here. Tanya Ray, thank you for the birthday wishes. So stay home, stay safe, stop the spread, and save lives. So let's segue in. I'll put a little picture of me down here in around where this cup is. And thank you to anyone who has given or will give super chat during the course of this broadcast. And thank you to all my Patreon supporters and the channel members. I greatly, greatly value you guys. And I thank each and every one of you who just positively interact, because that means a lot to me too as well. It's not all about that, but I have to say thank you to those special people who take the time out to leave super chat. I call it super love. Inner Peas, great to see you. Thank you for joining. There's Inner Peas, everybody, right here somewhere in the chat. No, over there is Inner Peas in the chat, so say hello to her. Shane Cordwell, thank you so much for being in here. I hope I said that right. All right, let's segue over. Let's get it going. Let's get it going. Here we go. Let me know if the volume is good for you.
Hospitalization numbers are down. Good news. We been hovering around 18,000, then we went to 17,000.
This is New York Governor Andrew Cuomo.
16,000, almost 17,000, but that is good news. We're down now for several days. The statisticians will say, are we past the apex? Have we hit the plateau and flattened for a period of time? And are we now on the way off the plateau and on the descent? If you look at the past 3 days, you could argue that we are past the plateau and we're starting to descend, which would be very good news. Again, it's only 3 days, but that's what the numbers would start to suggest. And you see that basically across the board. Hospitals will tell you that also. The emergency rooms have fewer people in them. Remember, they were at manic max capacity for a very long period of time.
This is New York State, guys.
Increased the hospital capacity by 50%, so every hospital had 50% more, and that capacity was overwhelmed, which just reminds us of the job the hospitals had been doing. But
it's as loud as it can.
The numbers, as well as what the hospitals are saying to us. You look at the 3-day average, which is more accurate. That is down. The ICU admissions, that I don't think is reflective of anything anymore, but we continue to include it for some unknown reason, are also down. The intubations are down, which is very good news. Again, intubation means you've been put on a ventilator. Probability is about 80% that you won't come off the ventilator once you're put on a ventilator, so that's very good news. But sobering news, on the other hand, happy days are not here again. We still have about 2,000 people yesterday who were new admissions to a hospital or new COVID diagnoses.
2,000 people.
That is still an overwhelming number every day, 2,000 new. If it wasn't for the relative context that we've been in, this would be devastating news, 2,000 people coming into the hospital system or testing positive. And if you notice, 2,000, we're not at the peak, but this is where we were just about in late March when it started to go up. So we're not at the plateau anymore, but we're still not in a good position. And the worst news is still tragic news, number of deaths, 540. It's not as high as it was. It's still 540 people died yesterday. 540 people, 540 families. 504 in hospitals, 36 in nursing homes. Nursing homes are the single biggest fear in all of this. Vulnerable people in one place. It is the feeding frenzy for this virus. Despite everything we can do and the best efforts of people who are working in those nursing homes who are doing just a fantastic job. Testing. Testing is the single most important topic for us to understand, I think, and it's important that we understand it. I spoke to one of my daughters last night who shall go nameless, but she said to me, what are they all talking about testing? Which was sort of sobering. I think I'm communicating information and facts, and my daughters are probably some of the most informed people on the situation, given the hardship they endure being my daughter during this period of time. And she was like, I don't understand all of this about testing, which is, again, it's a wake-up call to me. I think we're communicating. I think we're putting out this information, but you know, people have lives to live even in this crazy time. But for me, the best thing I can do in my position is to communicate facts to people so they have the information to make decisions. That's what I've been trying to do since day one. Here's the information, here are the facts. You decide, and I'll tell you what I think the course of conduct should be given these facts, but here are the facts, right? Before you tell me what you think, just tell me the facts, and then we'll get to your personal interpretation of the facts. So, facts on testing, because it is granular and it is a little boring, but it's also vitally important. Testing is how you monitor the rate of infection and you control for it. And that is the whole tension in reopening. Everybody wants to reopen. You don't need to hold up a placard saying we want to reopen. Nobody wants to reopen more than me. Nobody wants to get the economy going more than me. Nobody wants to get on with life more than me and everybody else. We're all in the same boat. We all have the same feelings. The tension on reopening is how fast can you reopen and what can you reopen without raising that infection rate so you go right back to where we were, overwhelming the hospitals. The infection rate now is one person infects 0.9 other people. You can't infect 0.9, but it's basically one person is infecting one person, tad less. And I don't even know if it's a tad less because I don't even know that the statistics are that accurate, frankly. So let's say one person now infects one person. That's where we are now. When that is happening, the virus is basically
Thank you, Kathy.
stable.
Much love. Thank you for the super love.
Where we were was one person was infecting 1.4 people. And that's when you have outbreak, widespread epidemic. We brought it down from 1.4 to 0.9. How did you do that? Those were the New York pause policies. close down business, close down schools, everybody has to social distance, everybody has to take precautions, masks, etc. But it worked, and we went from 1.4 to 0.9. Wuhan says at one point they got down to 0.3, which is where you really start to see the numbers drop. But that's where we are. The tension is when you start to open business, you start to have gatherings, you put people on a bus, you put people on a subway, you put people in a retail store, then you're going to see more infections. You're going to see that infection rate rise, and then you're going to be back to where we were. So how do you gauge this, right? How do you calibrate it?
Thanks, Josh.
That is all about
Josh, Katrina's looking for membership
and
link.
You have a
Would you be able to
tight
put that in the
window.
chat?
You're at 0.9 now. You can only go up to 1.2 before you see those hospitalization numbers start taking off again. You're talking about a very, very tight window that you have to calibrate. And this is all without precedent. So how do you actually do that intelligently? Well, you have to test. And testing informs the calibration. What is testing? Testing is you test. You test the person to see whether they're positive or negative for the coronavirus. There's also something called antibody testing, but let's put that aside for a second. On the diagnostic testing, positive or negative, you test the person. When you find a person who's positive, you then trace. Trace, they call them detectives. You find the person, and then you interview that person and find out who they came in contact, and you follow that tree down. That's testing and then tracing, when they talk about tracing. Trace all those contacts. And then you find the people who are positive, you isolate the positive people so they can't continue to spread. Tracing requires an army, literally an army. You would need thousands of people who just trace in the state of New York, right? Because any one person then leads to 10, 20 possible people who were infected. And you have to trace all through those people. You find a positive person, you isolate them. The trick with testing is not that we don't know how to do it. We've done it better in this state than almost any other state, almost any other country.
Oh, this is real, Angelina.
Bringing this up to scale. And these are private sector companies that are doing this. But we have done a very good job in testing. And the state has played a pivotal role in testing. You look at how New York, the number of tests we do. It's more than California, it's more than any other state, it's more than any other country. So we have had great success in ramping up testing. So we know how to do it. We know how important it is. We had that hot spot in New Rochelle, Westchester. It was the hottest cluster in the United States of America. And we jumped on it, and we jumped on it with intense testing, and it worked. You know, we still have an issue, but it's no longer a hotspot cluster because you do a lot of testing, you take the positives, and you isolate them. This is now, the challenge is now bringing this up to scale, okay? We did 500,000 tests in a month.
Thank you for the super chat, guys. Thank you, Josh
Bad news is,
and Kathy from Texas.
It's only a fraction of what you need. The more you test, the more information, the more you can reopen society. How does testing actually work? And this, again, you have to know the facts, otherwise this is all a blur and it becomes a he said, she said. There are about 30 private companies, large private companies in the country that are even international. 30 large companies make equipment to test. And they all have their own test, okay? So you have the Acme test, the this test, the this test, the this test. Those 30 companies have been selling their machines to local laboratories. And that's their business. They make a machine, Roche makes a machine, they then sell it to people, you have to buy their machine, and they then sell these local labs their testing protocol, because their test works on their machine. So you buy the Roche machine, you then have to buy the Roche test from the Roche Corporation. You buy the Acme machine, you then have to buy the Acme test from the Acme Corporation. And they sell these tests to local labs. We have about 300 local labs in our state who have bought these 30 types of manufacturers and 30 types of tests, okay? And then every time the lab goes to run that test, if I'm running the Acme test, I have to have the Acme equipment and the Acme vial and the Acme swab and the Acme reagents. What are reagents? When you take the swab, nasal swab, throat swab, you then test it with other chemicals. The other chemicals
Thank
are
you, Heidi.
reagents.
Thank you for the super
Depending on
love.
what test you bought, they have their own reagents for every test. So the Acme test has one set of reagents. The Roche test has another set of reagents, and you have to go back to them to buy these reagents. So that's the basic chain. And it gets very complicated very quickly because you have the national manufacturers who sold their machines to local labs. The local labs then need to go back to that manufacturer to run their tests. And there's very little uniformity among the tests. So you're trying to coordinate this whole private sector system. We have some public labs.
Joey Brooklyn, you don't have to
State
do
has a
that. Thank you, Joe.
lab, but the
Your
real
friendship
capacity is in these
means a
private
lot to me.
labs.
Thank you.
So how do you bring this up to scale? And how do you cut to the chase on this one? We called the top 50 producing labs in the state and said, tell us what it takes to double your output, okay? And this is literally what they said. So there's no interpretation here. Most of them come back. Sometimes they talk about the equipment, nasal swab, vial, but what you see is most of them are talking about we can't get the reagents. We can't get these other chemicals that we need to test. Where do they get the reagents from? Their manufacturer who made the machine in the first place, okay? And they all say, with the machines we bought, we could actually be doing more if they would give us the reagents. That's the log jam that we are in. They bought the machine, they have the test, but they need the reagents to do a higher volume of tests. When you go back to the manufacturer and say, why don't you distribute more reagents? They say one of two things. I can't get more reagents because they come from China, they come from here, they come from here. We don't make them in the United States. Or they say the federal government is telling me who to distribute it to. And this is why I say you have the federal government involved in this situation, rightfully so, because the federal government is saying to Acme Pharmaceutical, give X to California, give Y to Chicago, give Z to New York. These manufacturers are regulated by the federal government. And the federal government clearly has a role in addressing this crisis. But we need two things from the federal government. We need help on that supply chain, especially when it becomes international, and we need coordination and basic partnership. I get the state's role. We have been testing. I get this is hard. I get that it's difficult. I get that it's never going to be perfect. I get in this society there's going to be a blame game. And everyone's going to say, why didn't we have enough testing? It's the feds, it's the state. That's going to happen anyway, right? That's the world we live in. And I'm not asking for the federal government to come in and do any more than they need to do, but we do need their coordination, we do need their partnership. And we also need from the federal government, we need funding. I get that we have to fund airlines, we have to fund this business, we have to fund small business. Yeah, I agree 100%. But you also have to fund state governments. And by the way, when you fund the state government, you're not funding a private business, okay? We're not an airline, so you don't have an issue of should government really be giving tax dollars to this private entity. When you fund the state government, you just are funding a state government to perform the functions you want us to perform, which is the reopening function. I get it. I'll do it. But I need funding. And when you fund the state government, you're funding small businesses anyway, and you're funding hospitals anyway, and you're funding schools anyway. And you know, the Republican doctrine used to be limited government and states' rights. I'm a good distribution mechanism to small businesses and
welcome in.
hospitals and
Thank you for
schools,
joining.
because I know what's going on in the state. But if you want us to reopen, we need funding. National Governors Association is highly relevant because this is now all up to the governors. The National Governors Association is bipartisan. The chairman is a Republican. I'm the vice chairman. I'm a Democrat. I'm the incoming chairperson. We did a press release yesterday saying we need funding in this next bill. We need $500 billion for the states so we can do this reopening. Federal government yesterday sent 1.5 million cloth masks to New York State, and I want to thank them for that. These are cloth masks that we can distribute to people to help implement our policy where if you're in public, you have to wear a mask. It's not a surgical mask. It's a cloth mask manufactured by the Haynes Corporation, I believe. But we're asking people to wear masks, and this is going to be very helpful because we're going to have additional masks to distribute to the public. Last point, personal opinion. This is not a fact. This is just my opinion. You can throw it in the garbage. The emotion in this country is as high as I can recall. People are frustrated, we're anxious, we're scared, we're angry. We've never been through this before. And on every level, this is a terrible experience. It's disorienting, it threatens you to your core, it makes you reflect on your whole life, and it really has, it's mentally very difficult, it's emotionally difficult, economically it's disastrous. I mean, the market goes down, your retirement funds go down, you're not getting a paycheck. It is as tumultuous a time as we have ever seen. But in the midst of this, there is no time for politics. How does this situation get worse? And get worse quickly? If you politicize all that emotion. We cannot go there. That's why I work so hard. When anyone raises any political agenda to me, I work so hard to distance myself from it. I'm not running for anything. I'm not going anywhere. I'm going to be governor of the state of New York until the people kick me out. And then I'm going to go spend time with my family.
Amen. Amen, bro.
So I have no political agenda. And I've stayed 100 miles away from politics, just so people know that there is no possibility of a political distortion here, because it's no time for politics. And look, if you have partisan division splitting this nation now, it's going to make it worse. Abraham Lincoln, a house divided itself against itself cannot stand, 1858. Where did Abraham Lincoln get it from? If a house is divided against itself, the house cannot stand, Mark 3:25. Okay, so this is a accepted wisdom, let us say. House cannot stand. Not to mention, a house cannot rise up from the greatest challenge it has seen since World War II. This is no time and no place for division. We have our hands full as it is. Let's just stay together and let's work it through. And
okay, so I got to say, I agree with this 100% wholeheartedly, because when I was in the police department and a union delegate, the powers that be always try to conquer and divide the troops, the cops. So, you can't let politics come in and play a part in dividing and getting everyone to argue and fight against each other. We're trying to save people's lives. And this is something that none of us know how to do, including the politicians, including all the frontline people. There's no cure for this. There's no shot for it. There's no treatment that works per se. So what he's saying here, I happen to agree with. Catwoman, we all get that you don't like Andrew Cuomo, and I'm not a fan of his either, but I like the way he's, for the most part, overall handling the situation. Clear, concise, calm. That's what we need. We don't need someone who's going to instill fear in people. So putting all the hatred aside and putting all the anger aside, I say that, somebody like this is good to have in a situation where you can have people who panic. So at the end of the day, it's not my party. I'm not a Democrat. But at the end of it all, I think that in the midst of this whole pandemic where everybody is unsure. There's lots of unsure. There's unanswered questions. Michelle Vogel, thank you so much for the super love. It is my birthday now. It is 12:04, so it is my birthday. I got to agree with this. I got to agree. Hi, Hunter. Thank you for coming. Stephanie, good to see you. Thank you. It's my birthday. 56 years young today. I don't feel 56. And I said to my wife tonight on the couch, I said, "Hun, we were watching Butch Cassidy and the Sundance Kid. It was on the movie channel. So we were watching, I don't know if any of you guys seen it, from 1969. I want to see that movie came out in 69. Butch Cassidy and the Sundance Kid. We were watching it. And I said, holy shit, I'm going to be 60 in 4 years. Wow, I'm old. I'm old as dirt. And my wife was like, you're not old. 4 years is a long time. I said, look at the Google photos. Thank you, Just Believe. Look at the Google photos. Look at what we were doing 4 years ago. You know what I mean? Good evening, Dave. Dave in Osaka. There he is, my friend from Osaka, Japan. There he is, Dave in Osaka. Everybody go check out his channel after this video. Let me just continue with this. He's wrapping it up now. But my point is irregardless of how I feel about the New York governor, I have to say that I approve of the way he's handling things. My police counterparts can't stand him. He's not strong on crime. He's got a lot of weak points. I could sit here and break him down, but I'm not going to do that because there's a time and place for everything. And right now, there's no time for divide. There's no time for us to sit and dog somebody who is in charge of New York State. So for me, this is just my opinion. This is how I operate. I don't jump on the dog pile. Hello, Mia 2000. Thank you for coming. Patch Adams, thank you for the happy birthday wishes. Thank you, Gail, and everyone for the happy birthday wishes. Don't forget, tonight at 8 p.m. Eastern, I'm going to do a live stream to celebrate the birthday. So don't forget, tonight, 8 p.m. here on my channel, we will be doing a live, and tonight's really not the party night, but let's just continue with the end of this this conference. It's just another 5 minutes. It's another 5 minutes.
That's why we're called the United States, right? And the unity was key. Going back to Abraham Lincoln, it was always about the unity. Going back to the framers of the Constitution, it was always balance of power to ensure unity. And we need that unity now more than ever before. Questions?
I agree.
There's a medical tech company called HeartFlow.
Yeah.
If you invested $1,000 in that one, you could have turned it into 1.
Sorry about that commercial.
Last night, I know you addressed this a little bit the other day, but you're currently not wearing a mask. Do you fear that there's a do as I say, not as I do kind of aspect to this? And
Okay, all right, I got to stop it right here. So this snide reporter in the front row is basically saying, do you feel like you're sending the wrong message? You're not wearing a mask right now. Do you feel like it's a do as I say, not as I do kind of message you're sending out? So this reporter right here, I don't know what newspaper he's from or what he's right in the front, and he's wearing a black mask, mask. I'm telling you, the way he answers this guy, I give him a lot of credit, because if it was me, I would have told him to get out. And that's just me. And you guys know that I'm really calm about things. I would have told the guy, get the F out of here. You know what I mean? Thank you, Peggy K, for the birthday wishes. Thank you for the birthday wishes. Catwoman, thank you for the birthday wishes. I appreciate that. Sleeping Beauty, thank you for the super love. I appreciate that. Thank you. You guys are very kind. And thank you to Joey Brooklyn and Kathy from Texas, and all the super chatters. Joshua H, you guys are too kind. But let's listen to this. Let's listen to what the governor says back to him. I'm gonna roll it back so you guys can hear it. Hold on a second.
And the unity was key.
Mask order took effect last night. I know you addressed this a little bit the other day, but you're currently not wearing a mask. Do you fear that there's a do as I say, not as I do kind of aspect to this? And what would you say to somebody who's sitting at home saying, well, the governor's not wearing a mask, why should I?
When I am in public and I'm walking the dog down the street and there is a place where I could come in contact with other people within the social, and I can't maintain social distancing, I am wearing a mask. If I'm walking through the backyard alone and nobody's around me, I don't wear a mask. Wear a mask in public if you are in a situation where you could encroach on other people without maintaining social distancing.
Okay, so he answered them very calm, cool, and concise. Hi, Karen Seward. Thank you so much. Good to see you. He said, if I can't maintain social distancing, and that's part of his order, I wear a mask. But if I'm in my backyard or if I'm out somewhere where there's tons of acreage and there's nobody around, there's no reason for you to have a mask on. And this is what he's saying. So it was the response that he gave him, so calm and clear and concise. I just love this, that he did that. I mean, kudos to him for not losing his cool and telling him, like, really? You're going to ask me this stupid question? So he goes on to continue to make a point. He goes on to make a point that we're not in a public space. They were in a conference room that's huge and everybody's socially distanced. Everyone has the 6 feet of distance. So he continues to tell him why the mask is not necessary.
That's when you wear a mask. Here, I'm not going to come any closer to you than I am. There is no possibility that you and I, John, violate the social distancing guideline. I'm socially distanced from Howard, I'm socially distanced from Melissa, I'm not in public. In public, when, I'm not saying in your home, in public, that I think is a small inconvenience that has a tremendous benefit for people. And you wanna go walk the dog with me? I'll walk the dog with you. I wear a mask, and my daughter wears a mask. Dog doesn't wear a mask. I've not heard any data that suggests pets should wear a mask. So Captain's not violating anything, but we'll walk the dog, I wear a mask. Not as attractive as your mask, by the way. You have a very stylish, fashion-forward.
Governor, you're talking.
Did you catch that? It's not. I don't have a mask like your mask. It's very stylish, fashion forward, and look at the smile on his face. So he basically put him in his place. You know what I mean? Like, hey, listen, big guy. Back up. I don't need to wear a mask here while I'm giving a press conference. Dave, everyone has an opinion on this, and I don't poo-poo anyone's opinion. I respect it, but I kind of agree with him. Listen, I go out to the park and I walk. I do 2-3 mile walk a day. Today I didn't go out because it was raining, but when I go to the park, I bring the mask with me, and if there's nobody there and there's no one that's encroaching my 6 to 8 foot social distancing that I like. Premier Hell, thank you so much for the birthday love. I appreciate that. You didn't have to do that. I appreciate it. Harmony Love, thanks for coming. So I bring it. I don't wear it unless there's somebody, you know, that's going to come within that distance. If there's a crowd there, first of all, I wouldn't go. But my parks are just, you know, wide open. So I bring it out with me, but I don't wear it. I don't see any benefit to wearing it if you're in your backyard, or if you're like, someone just said that, I don't remember, I think it was Soul for Music said she went to buy a 9mm today at the store, at the gun store, and she wore it. I would wear it in a gun store if it's a small, you never know who's going to come in there. Like here, the executive order is if you go shopping or if you go grocery shopping in the store to get necessities, you wear the mask. You know, everyone's going to agree to disagree. Happy DutyRon Day. Thank you, Heidi. Thank you for the super love, too. So, you know, everyone's opinion will vary on this, but if you're out and you can't maintain that social distance, then you got to have it on. You got to have it on. Ralph's Trucking, great to see you. MTTV, oh my God. Oh my God. All right, let's continue.
About unity today, but President Trump has been encouraging implicitly and explicitly some Republican states to kind of move ahead with reopening plans. Beaches are reopening in Florida today. There have been protests at state houses around the country. What do you make of that sort of piecemeal approach?
Okay, makes no sense to me. He's asking him about what he thinks of Florida. This is nonsense. I'm not going to play this. But I don't agree with any opening of big public spaces where people can gather, because you can't control a crowd that comes out to the beach. So here's my thought on the beach. I'm going to answer it because the governor really doesn't mean anything. You're asking the governor of New York about what he thinks about Florida. He might be leading into that Long Island has beaches and things of that nature. Our beaches, our air show, the air show that opens up the summer season is canceled. So, you know, I feel that until the numbers are flat and level and there's no more death and there's no more hospital admissions and there are no more people being put on ventilators and intubated, I won't feel comfortable going out and going back to baseball games and going to see football games and concerts and things of that nature. It's just me personally. I won't feel comfortable with that if the numbers are still there. You know, this is a pandemic. This is a virus. This is a disease that there is no cure for. There's no shot. There's no treatment. There's no medical treatment. So at the end of the day, I feel that, you know, it's dangerous. You know, beaches down in Florida should not be open, because what if thousands of people show up there? How are they going to control that crowd if thousands of people show up and don't listen? Everyone's stir crazy. So if you open up a beach and you tell them it's okay, you can go to the beach, hundreds, thousands of morons are going to come out to the beach, and now you're going to have a clusterfuck there. You're going to have a bunch of people that are on top of each other, that are singing and dancing and drinking and partying. It's a disaster. It's a nightmare. When I saw the video today, I wish I could pull up a video from Fort Lauderdale. I saw the beach on Fort Lauderdale on an aerial shot. It was an aerial shot. Let me get this off. Hold on. Let me go to full cam. Hold on, guys. Let's get it to full. So it was an aerial shot of Fort Lauderdale Beach. I'm going to try to get it up. That sounds dirty, but I'm going to try to get that film and footage up so you guys can see this. So reckless. Trisha Brown, thank you so much for being in here, and thanks for that comment. Harmony Love, thank you for agreeing. Listen, we can all agree to disagree, but at the end of the day, you know, what's safe is what's safe. And what's going on with people, money-driven states want to open up. You know, states want to open up, right? And you're risking life at the cost. You're risking money at the cost of life. And for me, that doesn't jive in my book, because no amount of money in the world. Look at the Apple guy, right? Steve Jobs. He got cancer and he couldn't buy his way out of cancer because all the money in the world, there's no cure for it. Hello, Mary London. Good to see you. Thank you for joining. Today is my birthday. It is 56 years young for DutyRon. So it is April 19th. That is my birthday. So happy birthday to me. But, you know, you can't put a price tag on someone's life. And I feel and this is my opinion. You guys can, you don't have to agree with me. But, you know, it's my live, it's my channel right now that, you know, I'm talking about. I feel that, you know, money drives people to do crazy things. And there's a lot of pressure, you know, a lot of pressure on these leaders to open up for money to get the economy moving. And so you let the economy move at the price of innocent people.
Super love.
Ralph's Trucking, thanks for the super love. As a truck driver, I'm seeing
so many out-of-state drivers. YNY and as and CA. Stay home.
Exactly. Stay home. Stay home. Stay safe. Stop the spread. I can't agree with that more. You know, so I've been saying this till I'm blue in the face, and at the end of it all, it's just a saying. Inner peace. I'm not. I don't literally mean that. It's just a saying. I've been saying that for a long time. I think I've been saying that since I turned 40. But you know, politics and money go together, and they don't really have the best interest of public health in wanting to push to open. May 1st, May 15th, that's hogwash. It's hogwash in my book. You know, it's really hogwash. So I hope that New York heeds the warnings, because if you open any of the tri-state, that's New York, New Jersey, Connecticut, Pennsylvania, if one of those states open up, let's just say for argument's sake, Pennsylvania opens up. It's a huge state. Don't you think people from New Jersey and New York and Connecticut are going to say, hey, honey, let's get in the car and drive to PA. Let's drive to Pennsylvania because they're open. We could go gamble at the casinos. We can go to restaurants, and we can go and do what we can't do here. Let's take a weekend trip. And now you're going to get a bunch of New Yorkers, and I'm just giving an example, to go to Pennsylvania, or if it's Pennsylvania and New York opens, Pennsylvania shut, the old people from Pennsylvania are going to come here. And it's going to be just complete insanity. You know, it's utter insanity. So at the price of human life, you want to talk about open up the economy, people are dropping like flies. We lost 500 plus people overnight on April 17th. The figures for April 18th, for yesterday, for Saturday, will come out tomorrow morning. So, you know, the state of Maryland is small. If that opens, people from Virginia, D.C., and all the surrounding states are going to come there, and they're going to spread it. So it's not going to be spread in, you know, the states that are still on pause, that are shut down, but it's going to spread with people traveling, because you're not closing individual borders in the states. So it's just madness. It's madness. Let's hear what these reporters say here.
And considering that people travel, you know, could travel from Florida to New York, from Texas to New York, et cetera, doesn't that defeat the purpose of trying to stamp this out?
Look, I think no one should inject politics. And that's why, Jesse, you know, do as you say. You know how hard I've worked and how many times I've said, taken myself totally out of contention for any possible political position, just to make sure nobody could say there's a political angle to this. And I can't speak for anyone else. I can speak to my relationship, what I'm doing in this state, how I'm working with other officials for myself, and how I'm trying to work with the federal government. I think the president's point of there are different states in different positions, and once you say it's up to the governors, which is what he said, you're going to get potentially 50 different paths forward. And that's what he said. That is his model. He did not say this is a nationwide program that he's asking governors to buy into. He said it's up to the governors. So what I do here in New York may very well be different than what the Florida governor decides to do. And your point is well taken. Well, then can they drive to New York to Florida, Florida to New York? Yes, they can. And is that a downside of a 50-state strategy? You could argue that's a downside. There's no perfect way to do this. I'm trying to do it as a region, right? Connecticut, New Jersey, Delaware, Massachusetts, Rhode Island, et cetera. I'm trying to do it as a region because I think
I'm going to
that's
get to
better.
that soul for music.
But yeah, when you do individual strategies, the tension with that, and I think the rationale for the president, is you have different problems in different states. And I think the president leaving it to the states was not just right and legal and constitutional. I think he's right that it's different in different places. Look, when we look at this state and we talk about reopening, we're going to talk about different strategies in different parts of the state because the numbers dictate the strategy. And you have different numbers in different parts of the state. You raised the countervailing point, which is that, well, yeah, but then somebody could drive from place to place. Yeah, I understand that. And that's what we're trying to balance with the regional approach. I don't want people going to New Jersey or Connecticut versus New York, and how do we coordinate that? But you do have different situations based on numbers.
Okay, so New York, New Jersey, Connecticut, Pennsylvania, Massachusetts, I think New Hampshire, and there's like 6 states that are on that coalition that he's talking about. And the reason that everyone's going to be on the same page is what he just said. So those 6 states in the Northeast here are going to open probably together because he alluded to that. Obviously, if one opens, then people from other states are going to come. So here where there's such a saturation, the surrounding states are affected just as much as New York is because the spread is there. Like, look, I live in Nassau County and New York City. Those cases, if we look at the model, hold on a second. Let me get that up. Let me get that up for you guys. So if we look at this Johns Hopkins University model here, right? So this is the total cases, 2,329,539 positives worldwide, 160,717 deaths, and 3,698 tests done. Let me get that. 3,698,534 total tests conducted in the United States, not worldwide. If you look right here and go to the U.S., right, and then we break it down by counties, if I show you Nassau County, here's New York City, 135,000 confirmed cases. But look at Nassau. My county borders the 5 boroughs. It borders Queens. There's almost 30,000 cases in Nassau. It's a small little area. Suffolk County is a larger area, but it's further away. And that's still, an hour drive from New York, and there's 26,000 cases. But in my county, which is right on the border of Queens and Nassau, which is the 5 boroughs, that's New York City, there's 1,100 deaths in my county where I live with 30,000 cases. So where you have the border, the bordering states of New York, they all have to be, very careful. Look at New Jersey. Look at how hard hit New Jersey is. New Jersey, 81,000 cases. But look at New York, 242,000. 100 and something thousand of those are from New York City. So New York City has got the bulk of it. So anyways, that's a whole nother story, Torieri. I'm not going to get into that. That would be a whole nother live. But you're right. You're right, Torieri. You're right. So I'm gonna leave it at this. There's people that are protesting. Let's get back. Let's open up the states. That you see on the news all these morons, and I'm sorry I'm using that word, but it's moronic that these people are out and actually having the gall to protest and say, "Oh, we got to get on with our lives. Let's open it up. Let's open it up." Sporting Gusta, thank you so much for being here. Those people are freaking idiots. That's as moronic as I've ever seen in my life. You know, I don't know, guys. I don't know. You know, apparently people just don't care. You know, so everywhere is overpopulated. Go to California, the whole state. Everybody's on top of each other. There's places in New York that are so country-like with acres, like Cuomo said. Governor Cuomo said, if you go upstate New York where there's barely any cases, it's like going into the Midwest. It's like being in Montana. If you go upstate New York, it's wide open. There's farmlands, there's dairy farmers, there's hog farmers, there's cattle ranchers. New York State is huge. It's New York City where it's densely populated, where all this is going on. I could take a car ride 3 hours up north and there's literally no cases. Literally nothing. It's all in the New York metropolitan in New York City. So, you know, and I could show you examples of that. You know, I could show you examples of the state. I have it up on the screen here. Here, this is New York State right here in this area. And if you go up past Utica, here, there's nothing. Look, there's no little red dots, nothing. This is all New York State. It borders Canada. New York borders Canada. But look at where you're going to see all the red dots. Look at where the clusters are, right here in the New York City area. But if you go up north here, this is all New York State up here. There's nothing. There's nothing. There's no cases. So, you know, I'm talking about the city. I'm talking about the city. All right, listen, let me go before I get pissed off. You guys aren't getting my point. When you have density in a big city, that's where the spreads are. And if those people are allowed to travel up to San Francisco and up to Nevada and all across the place, this is how it spreads. But anyway, so I'm gonna click off of this. I'm going to say thank you to each and every one of you for giving Super Chat. Thank you for my channel members and all of the people who subscribe. Again, remember, all one word, DutyRon on all social media. Follow me on Instagram, Twitter, and Facebook, all one word, DutyRon. I will be live at 8 o'clock tonight, Sunday night. That's the 19th. It's already Sunday right now here. I know in California it's still Saturday, but it's Sunday here. Follow me for the live stream tonight. It'll be probably about 40 minutes or so, but I'm going to have some people come up onto the Discord server, and I'll have some people on the video on the Discord server, and we'll talk about birthday stuff. And you know what? Listen, we're all in this together. I celebrated my 29th wedding anniversary sitting at home here. We couldn't go out. You know, there was no celebration other than a dinner, a nice candlelit dinner. So I celebrated my 29th wedding anniversary pretty much in quarantine, or whatever you want to call it, stay at home. Now it's my birthday. My son's birthday is next week. I have no problem with being home. I have no problem with staying at home. If it takes 5 months, if it takes 6 months, if you have to be home to stop the spread and stay alive, the choice is clear. The choice is clear. And I get that everyone has to make money to make ends meet. But if you're dead and you're 6 feet under, what good is it being out? What good is it being out and working and making a paycheck if you're going to be dead, God forbid, the next week or in a month? You know what I mean? Thank you, Soul for Music. You know, listen, guys, we can't micromanage every word that I say. Everything that I'm saying is you know, all you have to listen to the message that I'm putting out to you. You know, each state has some dense population, especially the big ones. So New York, California, Florida. Look at Miami. It's got all the cases. Everybody down in Miami, it's a very densely populated area. You know, you go into Texas and you have your hot spots, but, you know, for the most part, the bigger cities is where you have the problems. Seattle, we had a big problem up in Washington because it's a big city, you know? So that's how it goes. But anyways, again, I appreciate each and every one of you. Thank you for sharing. Thank you for coming on in. And I will see you tonight, 8 p.m. All right, guys? A lot of love and respect. God bless the world. God bless the United States. And God bless each and every one of you for joining and for being in here. Stay safe. Stay home. Stop the spread. And I'll talk to you on the next one. Gail, thank you. Peggy, appreciate that. I'll talk to you guys soon. Soul for Music. Love and